issue of NHIF with them.
Thank you. Minister, can you respond quickly to those?
Thank you, Honorable Speaker and Honorable Members. I appreciate the question. The first question from Honorable Wamshomba on the remedy. That is the instant remedy as we speak. Honorable Speaker and Honorable Members, the crisis that we are in is affecting the health sector. But I also want to confirm, Honorable Speaker and Honorable Members, that level 2 facilities, that is the dispensaries, that are manned by the nursing officers are functional. Level 3 facilities, the health centers, are equally functional. Where this crisis has hit us most is on level 4, level 5, and level 6, where the specialized services are needed. Honorable Speaker and Honorable Members, we have put in place mechanism to ensure that emergency care that is required is given in all the national referral hospitals. But with the meetings that we have had with governors, we have asked them to also put in place measures to ensure that should a mother need emergency care or any Kenyan need emergency care, they should be attended to. Administrative actions have been taken, including employing some doctors on short-term contracts, including employing some locums to be able to fill the gap. So, as a ministry, we have put in our best effort to ensure that the services are being provided, but we acknowledge the crisis that is at hand. And that is why, Honorable Speaker and Honorable Members, I would like to plead the doctors of this country that the life is most important. With the monies, negotiations can always be done. If today you don't get it and circumstances improve tomorrow, a doctor will be able to be paid. But if we lose a life, we will not be able to recover that life. So I would like to speak to the doctors, Honorable Speaker and Honorable Members, that they come back and comply with the court order and suspend the strike and give these talks a chance so that we get amicable solutions. On the question raised by Honorable Mayaka on the diapers for mothers, Honorable Speaker and Honorable Members, I would like to confirm that the Kenya Kwanza government had a huge manifesto and there is a plan on delivering of the manifesto. Quite a number of the items that were listed in the manifesto have been achieved. Implementation of a manifesto is progressive. And I want to say, as a ministry, we are seized of that matter. And at the opportune time, when resources are allocated, and thankfully I'm speaking in the House that oversees resource allocation, once we get the resources for diapers, we shall be able to give them to mothers. But I want to confirm that this Kenya Kwanza government is committed to implementing its manifesto. The question raised by Honorable Malemba on the transition from NHIF to Social Health Authority, yes, there's a lot of anxiety across the country. Many people, and even facilities, are thinking that maybe their claims will not be paid. But I want to confirm to the nation that we have a transitional committee whose terms and of reference is one, to ascertain the claims, to reconcile the claims, so that the assets and liabilities of NHIF will be moved to Social Health Authority. Any claim that will not have been paid by the time we transit on the 1st of July will be taken over by the Social Health Authority. So I want to appeal to facilities, those who are denying Kenyan services, that your claims will be verified, reconciled, and paid once resources are available. And I have just confirmed, Honorable Speaker and members, that this week we have received confirmation from Treasury of release of 5.5 billion. That is going to go towards payment of claims. On the question raised by Honorable Naisula regarding the services, what are we going to do to ensure that services are ring-fenced under the Social Health Authority? Honorable Speaker and Honorable Members, the Social Health Authority is 90% digitized. And the reason why it is 90% digitized is to ensure that we remove the risks that existed in the National Health Insurance Fund that enabled or was able to oversee leakage of revenues and leakage of resources from National Health Insurance Fund. We have a digitized system that is able to ring fence, and equally in the new laws, we now have free primary health care under level 1, 2, and 3. That is going to be provided without a Kenyan having to pay anything. But once they are referred to level 4 and other level 5 and 6, then their Social Health Insurance Act fund kicks in to take care of them. The issue of cartels, Honorable Speaker and Honorable Members, is an issue of the system and governance. And that we are working on it. We have been able to demonstrate through KEMSA on what we have been able to do. Equally through the National Health Insurance Fund, the governance issue, we have taken care of it. Under the Social Health Authority Act, the board was carefully selected. We are going to do a careful selection of all the people who will work in that institution. But we should get the comfort of having a digitized system that is free from any manipulation to ensure that then systems run as envisaged. On the question of the cancer centers, and I want to acknowledge that indeed the national government gave these cancer centers. And like especially in the case of Garissa County, it is the county that came asking the ministry to ensure they hand over quickly the cancer center. And that was done. But we have received reports, including the Committee of Health which visited that, and we have a report at the Ministry of Health. And we are in discussion of how then we support those regional cancer centers. Because we cannot arbitrarily say that now we bring them back to the national government, but we can get into a framework of management. Because management of those equipment is capital intensive, and therefore we want to get into an agreement with the county governments on how we can jointly do that. On the issue of whether we have done a survey or not, we have the Kenya Demographic Survey that is done after every 5 years. And Honorable Speaker and members, I want to confirm that under the devolved system of government, we have positive outcomes on health. For example, the maternal mortality rate has reduced. The infant mortality rate has reduced. And there is clear indication that even the distances that were being traveled by Kenyans to access services have reduced based on the health facilities that have been put in place by the county governments. Having said that, I think there's an opportunity then for us to have a national conversation on all these areas, especially the other functions that are being done by the county government, and see then how best we remedy if there are gaps in implementation. On the issue raised by Honorable Modoni, as a ministry, we did gazette the transitional committee, and we expect there to be a seamless transition. However, we know that there could be challenges here and there, and the biggest risk we have identified as a ministry is the unpaid claims. So we are in discussion with National Treasury to ensure that these claims are paid, so that then they do not impede the transition from NHIF to Social Health Authority. But also want to confirm that under Social Health Authority, there is no pre-authorization that is needed for emergency care. If you need emergency care, there is no pre-authorization that should be provided. Under the existing National Health Insurance Fund, there was selection of facilities, and that is one of the items that we dispensed with in the Social Health Authority. There is no more selection of facilities by Kenyans. If you are registered to get services wherever and whenever you are. And we are going ahead with digitization to integrate all services and ensure that there is movement and portability of patient data. That should a patient want to move from one facility to the other, they do not have to carry exercise books, they do not have to remember anything, they'll find their data available at their next level of service. And equally, the ideal situation is that patients should be able to manage their information on their mobile phones. And that is an ideal situation that we hope to move to into the future. The question from Honorable Farid, Health Services Commission. Honorable Speaker and Honorable Members, I think this has been a question generally in the public, but the creation of Health Services Commission is beyond the mandate of the Ministry of Health. But I want to believe that during this time, during this crisis, when we have all of nation approach, we are going to listen to all suggestions and indeed it's determined that Health Services Commission is the cure of the perennial issues that we have, I believe the responsible arms of government will then be able to start a conversation. But having said that, the Kenya Kwanza government operationalized the Kenya Health Human Resource Advisory Council. It is meant to be able to manage the human resource for health, be able even to manage the distribution of different cadres across the counties. And all we need is resources to finance that. On the question of Honorable Beatrice Elachi, I have already confirmed that we have an issue with the claims. But I want to believe that once we receive these resources that we are expecting this week, from next week we start payment. But Honorable Speaker, also to confirm that payment of claims is a continuous exercise. Last year only, NHIF paid out a total of 36 billion in terms of claims. So this is a continuous exercise that will continue, but where we have specific cases as a ministry, we are ready and we shall be looking into the specific issues that have been raised so that we handle them. Honorable Speaker and honorable members, I would like to confirm that the Kenya Kwanza government has a plan on delivering UHC. And as a ministry, we have clarity on what we need to do to deliver universal health coverage. We have worked on the commodities through the reforms at KEMSA. We have worked on financing through the laws that we have put in place, and we had already started working on human resource for health. Unfortunately, this crisis came in, but I want to believe that it is an opportunity for the Ministry of Health to be able to resolve the HRH issues for once and for all. Honorable Speaker and honorable members, I submit. Thank you.
Thank you, honorable members. Thank you, Minister. That is the end of question time. You and your team are released. Next order.
Order number 9, the National Land Commission Amendment Bill, National Assembly Bill number 43 of 2023, second reading, resumption of debate.
I'm told Honorable Zamzam was on the floor. Can you wipe the screen so that I see who the new interests are? Beatrice Elachi, you want to speak to this? Carolo Mundi, okay, we'll start with Beatrice Elachi. Carolo, you better log in. Don't see you on the screen.
Thank you, Mr. Speaker. Mr. Speaker, I raise